feature, and that is, of course, the coronavirus pandemic. I'm joined now from Melbourne by GP Peter Lewis, Dr. Peter Lewis. Thanks for joining us, Peter. I'm pretty keen to get your advice to the nation, really, on obesity and its link to coronavirus infections and how people can get through it.
Yes, well, this is very important. We know that obese people are more likely to suffer from reduced immunity and also from inflammation. Now, inflammation, if you're admitted to hospital, is one of the things that's going to get you into an ICU unit. So we can all help ourselves by lowering our weight and therefore improving immunity and saving the ICU beds for the people who really need it. After age, which we can't do anything about, the most important risk factor is your weight. So this is a time when we can all help the community and help ourselves, and we can flatten the curve by flattening our belly.
That's a fascinating and important insight, because we all know the importance of age. We know the elderly are particularly vulnerable to coronavirus. We've heard a lot about smoking as well. Heavy smokers hit harder, which is unsurprising because this leads to lung infections. But you're saying that weight or obesity is even more of a risk factor than smoking?
Yes, significantly more. We know that obesity cross-relates with all the other important risk factors for a negative outcome with COVID, and they include diabetes, hypertension, heart disease. So you can reduce all those other risk factors by reducing the risk factor of weight.
Now, this is worth knowing for a couple of reasons. Of course, that's always good health advice not to be overweight, but if you're like me, during this lockdown period, you put on a bit of weight, start losing it now, because this infection, this virus is going to be around for many, many months, possibly years. So it's good advice to slim yourself down and increase your chances, right?
Correct, yes. More important than ever. And I think we're all looking for some way that we can control our environment, and we can turn this into a positive for ourselves. Because not only do we help ourselves if we lose weight, but it's good for the community, because a lot of people don't realise that obesity leads to increased viral shedding. Particularly, the obese tend to be sick for up to twice as long as a slim person. So that means that's less time that you're infecting other people.
Great advice there, great information, Dr. Peter Lewis. Appreciate your time.
Thank you.